Good morning, Ms. Brown. Can you please say your first and last name and your date of birth?
My name is Florence Brown and 9/10/1950.
And what brings you in today?
Well, 10 days ago, my cat Francis bit my arm and I developed this nasty wound right here. I took some leftover Bactrim from this one time I had a UTI about 2 years ago, and I'd never finished the prescription, so I had about 4 days worth this time, and it seemed to help a little, but it's so tender and red and this nasty green drainage.
Okay. Do you have any chest pain or shortness of breath?
No, not really chest pain or shortness of breath, but I have had some muscle cramps and like these bubbles popping feeling in the left side of my chest every now and then.
Do you have any other past medical history problems I should know about?
Oh yeah, I have high blood pressure and high cholesterol. Matter of fact, I have the meds in my purse.
Do you mind if I look them?
No, not at all.
Alright, I see lisinopril 20 milligrams daily, simvastatin 10 milligrams daily, and then this must be the Bactrim. Does that sound right?
Yep, that sounds right.
Alright, let's just go over your social history really quickly. So do you smoke any cigarettes, use alcohol, or any other drugs?
No smoking of anything or drugs, but I am sober from alcohol as of 10 years ago last month, and my primary care physician is pretty keen on watching my liver function.
Well, congratulations on your 10-year sobriety, and thank you for your honesty. Now I'm just going to go ahead and take some vitals if you don't mind.
Sounds great.
Alright, start with the temperature, under the tongue. Good. And do you mind just slipping your arm out of the robe and I'll take your blood pressure?
Just careful of the wound.
I'll just slip right in there. Very good. I'm going to slip this on. I'm going to attach this. It's just going to monitor your oxygen, so it shouldn't hurt or anything. I'm going to take your respirations, okay? Your pulse. Good. I'll take that off. Alrighty, so your temp is 97.6. Your heart rate's 74 and a little bit irregular. Blood pressure is 105/60. No fever. Your respirations are 18 breaths per minute, and your oxygen was 95% on room air.
Irregular? Does that mean I'm dying?
Nope, your blood pressure is just a little bit low, and your heart rate is a little irregular, which just means it's not beating in a consistent pattern.
Okay, so I'm not dying.
You're not dying. Okay, so now I just want to go over your medications with you and some of the negative side effects that may occur when you take medications not as prescribed. First and foremost, it's very important you take the full course of antibiotic. And don't stop taking the antibiotic once you feel better, and you should never take part of an old prescription. This leads to antibiotic resistance. In addition, it's very important to take the medication as prescribed, as there's many drug interactions, such as leftover Bactrim that you took with the lisinopril. Taking these two medications together can cause hyperkalemia.
What the heck is hyperkalemia?
Hyperkalemia is when the potassium in your body is too high, which causes an irregular heartbeat and muscle cramps, which is what I believe you are experiencing today.
Oh jeez, I'll never do that again.
In addition, we need to contact your PCP, and I want to get the last liver function test and compare them to today. To ensure that there's no other drug interactions given, you are taken with simvastatin and you're a former alcoholic.
Okay, sure. Do you need my primary care physician's information?
That'd be great.
Okay, it's Dr. Smith from Family Medicine.
Thank you very much. I'm just going to go ahead and look at your arm if you don't mind and give a little assessment.
Whatever you have to do, just careful. It's pretty tender.
Okay, so I see your wound is a little swollen, firm, painful to touch, with a thick yellow-green discharge and crepitus.
Yeah, holy crap, that hurt.
I'm sorry. Okay, now I'm going to document all this, and the provider should be in to see you shortly. Do you have any questions for me?
Nope, not yet.
Okay, I'll be around.